Many men believe that alcohol and tadalafil should never be mixed. It often feels like a strict medical rule, especially when someone is starting treatment and wants to avoid doing something wrong. What is less known is that the body's response depends on several factors working together, not just on the presence of both substances at the same time. That's why many men don't realize the actual level of risk may be different from what they assume. Hello, I'm Dr. Ananya Rao. I work with men's health and urology, and here on this channel I explain medical topics in a clear and practical way, so you can better understand your own body and health. In this video, I'll help you understand how alcohol and tadalafil each affect the body, how they may interact, and why the level of risk is not the same for every man. To understand this interaction, it helps to look at what each substance does on its own. Tadalafil works by relaxing blood vessels, which increases blood flow to certain areas of the body. This is why it's used to support erectile function and, in some cases, urinary symptoms related to prostate enlargement. Alcohol also affects blood vessels. In small amounts, it can cause temporary relaxation of blood vessels. In larger amounts, it can affect the nervous system, coordination, and the body's ability to regulate blood pressure. When alcohol and tadalafil are present together, the body has to respond to two signals at the same time. The effect depends on how much alcohol is consumed, how much tadalafil is active in the system, and how efficiently the individual's body processes both. This is why the response can vary widely from one man to another. One important effect involves blood pressure. Both tadalafil and alcohol can lower blood pressure by relaxing blood vessels. When combined, this effect may become more noticeable in some men. In many cases, the body compensates by adjusting heart rate and blood vessel tone, so men may not feel anything unusual. However, in men who already take blood pressure medication or who consume larger amounts of alcohol, this compensation may not work as smoothly. This is why some men may feel lightheaded or dizzy, while others notice no change at all. Another factor involves nervous system coordination. Tadalafil does not directly affect the brain or nervous system in the way alcohol does. Alcohol can reduce coordination, judgment, and the body's ability to respond quickly to changes in position or circulation. If a man drinks heavily while tadalafil is active in his system, the combination may make it harder for the body to stabilize blood pressure when standing up quickly. This temporary drop in blood pressure is often referred to as orthostatic hypotension. The body usually adapts to this, but alcohol can slow that adaptation. Individual health factors play a major role in how this interaction feels. Men with healthy cardiovascular systems who drink occasionally and in moderation may experience no noticeable effects at all. Men with heart conditions, liver problems, or those taking multiple medications may be more sensitive to the combined effects. Age also matters, because the body's ability to process both alcohol and medications can change over time. This is why general warnings exist, but individual risk can be very different from one man to another. Dosage and frequency are also important considerations. Tadalafil comes in different doses and can be taken daily or only when needed. Daily low-dose tadalafil maintains a steady level of the medication in the body, while higher doses taken occasionally create temporary peaks. The timing of alcohol consumption relative to when tadalafil is taken can influence how the body responds. A single glass of wine with dinner is not the same as consuming several drinks in a short period of time. The body's response depends on these details, not just on whether alcohol and tadalafil are both present. This does not automatically mean that alcohol must be completely avoided while taking tadalafil. In many cases, moderate alcohol consumption may not cause noticeable problems, especially in men without underlying cardiovascular conditions. Becoming aware of how your own body responds is often the first step in making informed choices. Every man's body is different. Symptoms and changes can have multiple causes. This video is educational and does not replace medical evaluation. If symptoms persist, or if you have concerns about combining alcohol with any medication, Speaking with a qualified doctor is always the safest step. Now I'd like to ask you a question. Have you noticed how your body responds to alcohol when taking medications? If you feel comfortable, you can share your experience in the comments. If this video was helpful, consider subscribing. In the next video, I'll explain how dehydration can affect erectile function and urinary symptoms. Understanding your body is an important part of taking care of your health.